Hi friends, I'm Dr. Imran Damani. I'm a practicing cardiologist, diabetologist in Austin Town, Bangalore. Today I want to tell you about the newer risk factors for heart attack. We all know diabetes, hypertension, obesity, sleep apnea issues, they are the main risk factors for a heart attack. But the fact is, still many youth, especially in 20s and 30s, are suffering major heart attacks. And the surprising fact is, they are not hypertensive, they are not diabetic, and neither is the lipid profile bad. This is a story which is very common in our hospitals. Almost 20 to 30% of the patient load is all young people who are not diabetics, not hypertensive, normal lipid profile and normal weight. So what are we missing? There are certain interesting risk factors which have come up, and I want to tell you about that. The most important risk factor, which actually we all know and we don't talk about, is smoking. Smoking is one of the most dangerous risk factors. It is causing cancers, it also causes heart attacks. So young people who are smokers are at risk, irrespective of their age, irrespective of their other risk parameters. Next risk factor which I want to talk about is physical inactivity. It is called the sitting smoking. If you are not active, you are asking for trouble. If you are not active, you are asking for more obesity, you are asking for more issues, not only just hypertension, not only diabetes, but also cardiac issues. Physical inactivity is bad for heart. It is required that we exercise, we walk at least 8 to 10,000 steps per day, and if not possible, at least cross 5,000 steps a day, which is good for the heart. A person who exercises regularly, who is physically active, who is not very much couch potato, who is physically fit and keeps himself active throughout the day, avoids a heart attack issue. And the third most recently seen risk factor, which actually has been the talk of the town, is high inflammation. Where do you see high inflammation? This is often seen in smoking, also seen in certain viral diseases like COVID-19 caused high inflammation. After COVID infection is subsiding, patients had high inflammation. It is also seen in bacterial infections also. But once the disease goes away, a certain amount of patients, they do have the inflammation because of the post-disease effect. And when that happens, that can cause more stickiness in the blood. It can cause heart attacks. Often we have seen many patients who had suffered COVID in the pandemic, many of them suffered heart attacks or strokes after few weeks and months. Which is why the whole thing is that we should find out if our inflammatory parameters are high. How to detect this? We have certain simple blood tests called ESR, called the CRP and the D-dimer. If you ask any laboratory, they will help you doing this test, and if these parameters are high, your inflammation is at high risk and you are also the risk increases. So first do this blood test, find out if you are in the risk of having high inflammation and show it to a nearest physician. Alright, thank you so much.